My name is Dr. Chetan Ginigeri. I'm a children's ICU specialist working in Bangalore. And in our ICUs, almost 30 to 40% of our work is treating children who have put themselves in danger. Children who have fallen down from balconies, drowned in swimming pools, electrocuted in our homes, having consumed corrosive poisons and other dangerous things like button batteries, or having bitten by snakes and scorpions. These are all children who would have been playing 1 second and fighting death another. No other disease in mankind is killing as many normal children as much as accidents. The sad part is 90% of these accidents are easily preventable. Childhood accidents are predictable and preventable. Child safety is not our choice. It is a responsibility. We owe it to the generations of the future. Let's make this world child safe.
Choking is one of the most commonest emergencies we see in our emergency rooms nowadays. It's mainly because children, especially infants and toddlers, have a tendency to explore their immediate surroundings by putting things in their mouth. That's because the nerve endings in our mouth and tongue is much higher than what's there in the palms and soles. So for exploring the environment, to feel it, to find its taste, texture, children tend to put everything in their mouth, be it a lint of dust, a button battery, sometimes pin, or a crawling insect. All these things are choking hazards. The other main cause of choking hazard is playing while eating. A very common mistake which parents do while feeding children is that children will be jumping from one sofa to another while mothers are chasing them to feed. And when children are jumping, there is a very poor coordination of breathing as well as swallowing. And sometimes this food bolus can inadvertently enter into the windpipe, blocking it and causing severe breathlessness and sometimes death. Children less than 3 years should always be given mashed and grated food. They just know how to suck and swallow. Their chewing movement and breaking down of food into smaller particles is not yet a learned behavior. So any hard candies, any hard nuts or vegetable pieces, children will have a tendency just to swallow, and sometimes it gets stuck in the throat, in the food pipe or in the windpipe. How do we prevent choking in small children? First, all children less than 3 years should always get mashed and grated food. No hard candies, no hard nuts or vegetable pieces. Make sure even the visitors who visit the home know about this routine and do not offer children these hard candies. Next, have a feeding routine. Have a place to sit. Make the child be still while feeding. The child should not be jumping from one place to another or running around while feeding is going on. All toys with detachable parts are choking hazards, and we have to be extremely careful for any of these loose springs, balls and detachable springs be there in the child's mouth. The child will try to pluck it and sometimes get choked on it. And in case your child has choked on something, never ever do a blind sweep inside the child's mouth. You can usually push this foreign body down into the foot pipe or very rarely and dangerously into the windpipe. Just be with the child and rush the child to the hospital with a good pediatric center, because child may sometimes require a visit to the operation room to remove these foreign bodies from their windpipe or a foot pipe. Be careful. With children under 3 years, they are extremely prone for choking accidents.